Hello everybody, here is my try of a rendering of the first article, which was due for a long time already, but oh well. If it has to be done orally, here it is, done orally, based on a written text, though, of course. So, here's the video. The headline of the article I've read is NHS walk-in centres closures will put more pressure on A&E. The article is written by Patrick Butler, and it is taken from the newspaper The Guardian, where it was published on Monday, 11th November 2013. The problems addressed in the article are urgent, mostly for low-income patients who are not registered with a local surgeon, and also any people who find it more convenient to visit NHS walk-in centres instead of going to their GP or to the A&E units. The subject of the article is NHS walk-in centres, of course, some of which have closed recently. And the purpose of the article is to give the reader some information on the reasons of this happening. The article deals with one burning problem of life, which is English healthcare. The author starts by referring to the research of Monitor, which is the main healthcare organization, regulator service, rather, in England. As the results of the research have shown, nearly a quarter of all NHS walk-in clinics, of which there are more than 230, have closed in the past 3 years. Those clinics were launched as part of a Labour initiative, government thing, to help people get access to healthcare treatment without getting a speedy appointment or something like that. Some of the closures were caused by the census being too successful and attracting way too many people with minor conditions, while others were closed after failing to attract enough patients. Still others had to close because NHS commissioning authorities could no longer afford them and decided to make savings instead. Most of the walk-in centers are located in the poorer urban neighborhoods and are used by low-income people, mostly for minor illnesses such as colds, sprains, or cuts. When asked where would they go if there wasn't a walk-in center available, 1/5 of the patients answered that they would visit the nearest A&E unit. That makes some people concerned whether walk-in center closures will put more pressure on A&E, which leads us to the title itself. British Health Minister Lo Howe commented on the situation that the patients should be able, of course, to access healthcare, but there needs to be more than one solution for different people, such as family GPs, community services, and pharmacists. The article is finished by a quote from Chand Nagpal, chair of the BMA General Practitioners Committee, who said that when the times are tough, NHS commissioners need to allocate the funds properly, correctly, to avoid health service duplication. I found the article topic rather interesting, yet of little importance for me, as I don't live in Britain. In my opinion, the article is worth reading if you're interested in British healthcare system and how it's been changing or evolving slightly through the recent years. The article doesn't express much of the author's opinion, relying on the facts and quotes instead. So, there is that. That's the end, I guess. Bye.